O is for Oncotype DX. Now, Oncotype is a genetic test done on the breast cancer itself after a biopsy or surgery. It looks at the activity of 21 genes linked to cancer growth and recurrence. Now, the result is given as a recurrence score, a number between 0 and 100, and this tells us how likely your cancer is to come back and whether chemotherapy would add extra benefit. Now, we normally make the chemo decision using a tool called Predict, and that looks at your individual tumour factors such as age at diagnosis, size, grade, number of involved lymph nodes, and your receptor type, and it tells us the benefit of chemotherapy for someone with your exact cancer. If that benefit is borderline, Oncotype can help your team work out whether they should offer it to you. Now, the NHS have approved it for patients with ER-positive, HER2-negative breast cancers smaller than 5 centimetres with no more than 3 involved lymph nodes. Because if you have a cancer that's larger than that or you have more involved lymph nodes, you're likely to be offered chemo anyway. 2 large trials showed that for many women with a low or mid-range recurrence score, they could safely avoid chemotherapy and its side effects. In other words, chemo didn't reduce their risk of recurrence. But if the Oncotype score is high, particularly in younger women, it is likely that chemo will make a real difference and reduce your risk of recurrence. But sometimes the score still comes back as borderline, so it hasn't really helped. We don't use it for HER2-positive or triple-negative cancers, as you will automatically be offered chemotherapy as part of your treatment. It's also not designed for people living with metastatic disease, and that's because once the cancer is spread, we already know we're going to give you stronger treatments like chemotherapy. It's not perfect. It can't predict with 100% certainty who will or won't benefit, but it does help. And paying privately for Oncotype usually isn't recommended, because if your cancer type doesn't fit the trial evidence, the result may not be valid or helpful. I'd love to know if you're enjoying my alphabet series, and tomorrow we move on to P, and there are so many options.